thanks for coming by.
Thanks for having me.
So there's this online rumor, one of these viral things going around, that giving ice water to a dog, which may seem like a good idea when it's 95 degrees out, can actually kill the dog. True?
Absolutely false. One of those great things about the internet, you got to check your source. And a friend told a friend and it was actually responded to by a major university, a veterinary school, and completely false. Just a nice, cool, refreshing drink.
Good way to make a mess.
Quickly.
I mean, I could see the ice chips flying all over the place.
But not harmful.
So pets want to be outdoors. They want to run around. It's 95 degrees out in the heat of summer. What do you do? What's the best way to try to keep, especially a dog, more active, comfortable?
Well, I think the important thing is to understand that they don't get rid of heat as well as we do. They do not sweat very well, so they pant. They have a little bit of ability to sweat through their pads. So we have to be very conscious. And when the weather is extremely hot, especially if they're dark in color and they absorb a lot of the heat, they can overheat quickly. So we need to keep them in shade, not over-exercise them. Dogs are very willing but not often able, and will get themselves in an overheated situation.
How do you know? What are the warning signs?
Really excessive panting, very broad tongue, breathing heavily, acting lethargic, fast heart rate, if you can feel that and appreciate it, are the early signs of heat stroke.
Now, excessive panting and panting, I mean, they're supposed to be panting, so that's
so this is when you'll see a dog really moving air a lot, really panting, just working. Could do an imitation, but it wouldn't be pretty.
Thank you.
So just really with their tongues hanging out, it will be very wide and remaining out, and they'll just be breathing rapidly.
Okay. Other things I was reading about with dogs running around, especially in the summer, is so they're outside, people are throwing stuff around. I'm thinking about the injuries that occur. Somebody's running the weed whacker down the street. There's all sort of stuff flying around the air. What sort of injuries do you see this time of year that you may not see 6 months from now?
Well, one thing is, what's really sort of interesting and sad is that dogs that are not conditioned are brought out and they're asked by their owners to run, to catch things, and they tear ligaments and do joint damage because they're not really fit.
This is like people, weekend warriors.
Yes, exactly. So we'll see the result of that. Some dogs are extraordinarily fit, and it's not a problem. But we do ask people to really train their pets and get them used to it, especially if they're overweight or not used to physical activity. So we see cruciate ligament injuries, which are very common, a lot of pad injuries. One thing we're seeing a lot of is asphalt burns from hot black asphalt on their pads, because they really are sensitive. Sunburn across the nasal area in dogs that aren't pigmented. And then penetrating wounds and foreign things.
You see people out for a run, and the guy will be on the sidewalk, and the dog running with him is on the grass.
Right. That's how it should be.
A little bit more comfortable.
And again, they're willing to do it. So dogs will push themselves beyond. That's one of the amazing part about watching your dog. It is always ready to go, but the question is it good for them? So limited time, try to catch it early in the morning. Try to go after the sun goes down a little bit when it cools off would be ideal.
Do pets get allergies?
They do get a ton of allergies. Food allergies, they get inhalant allergy or pollens, what we would call in the old day hay fever or atopy, and contact allergies. So we treat a lot of that.
I'm thinking about the seasonal hay fever stuff.
Yeah, seasonal is tremendous, and there's some great products that can help that. The drug line, there's a new drug that came out recently that was fantastic, but instead of manufacturing enough of it to last for what they expected, which was 9 months, it ran out in 2 weeks and created a national shortage.
What was the drug?
Apoquil.
And what did it do?
Wonderful. Just it stops some of the immune response without using steroids. So it's a really wonderful drug, and it will be back in January, and we're thrilled about it.
Is there a people version of that one?
There actually, this is one of the unique drugs that came out in veterinary medicine before people. It's really selective for allergies.
We've explored that. Let me first remind our viewers, if you have a question for the veterinarian. You can give us a call. We'll have the number up on the screen. You can also tweet a question. Our Twitter address is @MPT News. We've talked before about the intersection of the human pharmacy and the veterinary pharmacy, drugs that sometimes work just fine,
Yes.
some like Tylenol that are a big issue.
Well, certainly, I have in my career become more and more convinced that the safety is in using drugs that are specific for pets. I think they really do a lot of research. And I had commented in preparing for this show, hours of study.
Your whole life, actually.
Yes, that there are some really new novel drugs that are coming out with incredible safety. There are oral flea and tick pills, which are just unbelievably safe, that last 12 weeks. There are now new approved injectable heartworm preventions that last 6 months. A lot of medicines that work around safety and convenience for owners.
Let's take a phone call. This is Michael in Anne Arundel County. Michael, thank you for calling. Go ahead.
Michael.
Yes, we have a lab mix, and she has a big, massive tumor on her right hip. We're trying to figure out what is the quality of life. The surgeon said, well, try to remove it, but he couldn't guarantee that, it's not going to come back malignant. But the price to have all of that surgery done, and then he said, well, that's just taking the tumor out, but it's still not going to guarantee anything else. And right now she's doing a lot of shedding. She smells real bad. I mean, the tumor is just very ugly. I mean, it's about the ugliest thing you could ever see. It looks like something off a movie.
Yeah.
So right now she's starting to hip, carry the hip. It's on her right
show
hip.
signs. How old is she?
8.
She's 8.
Yes.
Well, I would say that a lab mix that's 8 years old has a lot of life ahead of her, and I would consider doing things that could stage or give you an idea of what it is, and then it would be worth removing it in order to give her a quality of life. She can live another 6 or 8 years, and that would be worth it.
We happened to be discussing some of these issues before the program. I mean, what factors into the advice that you give to somebody? Say it's a longtime client, patient of the practice. How do you know what to do?
Well, and for me, a lot of that is I try to balance my personal opinion with my professional opinion to our clients, and I think they really appreciate. It will sometimes come down to, what would you do, doc? And I think quality of life is important. There are limited lifespans. We can't live forever, and we have to almost grade our pets and their problems with what we would expect as an outcome, and the quality of life. Are they eating? Are they able to be active? Can they go outside? Are they continent or not going to the bathroom in your house? And then make decisions, but I think it's essential for the veterinarian to give people information, or even sometimes visit with specialists for consultations to just get the lay of the land and have an idea of what are possible cures and help.
I guess one of the differences with humans and animals, pets in that situation, is that the human understands, or it can be explained to a human being why you're going to undergo this painful, difficult regime or treatment or surgery. You can't explain that to the pet.
Well, and as my friends who are physicians have said, to make us not feel so sorry for ourselves as veterinarians, that pets don't lie. Said people can really tell untruth like a lot, and they really do the best with what they have. So it is phenomenal to see pets that deal with amputations, that deal with removal of an eye. I've just seen a patient, wonderful lab today, Maya, who had a major ear surgery. Fantastic. They just do with what they have and move on. And it's almost inspirational to watch that. So.
Yeah. Oh, I want to, in a second, talk about the other side of the cycle of life there, and new pets and what we do there. Let's talk to Myra in Prince George's County. Myra, thank you for calling. Go ahead.
Hi, Myra.
Yes, I have a question. I have my dog. I have a Yorkie that's 11 years old, and he's been on the heartworm medication for all of his life. And I have a cat as well that is on the what is it? Oh my gosh, Frontline.
Okay.
And you just said that there are other drugs.
Yes.
How do I let my vet know about this?
It's a great question, and we've become, at Eastern Animal Hospital, we're just very comfortable with people bringing us information. I think you just need to politely approach it, even bringing some inserts or information you get about other products. A great product for a cat is called Revolution. It's been out for quite a while, and it gives a wide spectrum of medicine. It's a topical. And some of these other products, you just need to have a frank discussion with your veterinarian and say, I'm interested, what do you think? And I think the answer will reveal a lot about what type of practitioner you're dealing with.
And you can say you saw it on television.
Yes, as seen on TV.
Yeah, the fellow seemed really trustworthy, and that's a good reason to inquire. I mean, that's a good conversation
Absolutely.
starter
And
right
we
there.
embrace people bringing information with the internet now. Our clients are much more informed, and we really try to use that.
Now, I wanted to talk about kittens and puppies a little bit, happier stuff.
Right.
And let's get into training and your philosophy on, you only get one chance to make a first impression, they say. Do you only get one chance to get the training right? Otherwise, remedial training's a lot tougher than getting it right in the first place.
It is, but I think people have come a long way in what is training. And now behavioral modification and working with bringing out the positives in your pets. The essential part in a dog is to understand that dogs need leadership. And dogs that do not have leadership tend to be poorer citizens. And there's more work to be done with cats, more fun things. One tip I just heard at a recent behavioral lecture for a cat was to hide small amounts of dry food throughout the house to give them a little bit of hunting, of fun, and some mystery and some activity. And I thought it was a really great idea, simple to do.
Are crates in or out?
Crates are in as a safe way for dogs to increase housebreaking, to give them a safe place to stay.
It doesn't seem like a nice thing to do.
Oh, but it's a natural, it's for them their cave and what they would consider a den, and it's a safe place. And my dogs personally, when you open the crate, they know to go in, they're very comfortable with it, and it's a wonderful way, especially if you have people over who are not so thrilled with pets, they can have a safe place and be contained.
Let me look at a Twitter question. Are there any breeds of dogs that are good to have in the city as opposed to a house with a yard?
It's a tough question because it depends how active you are. My hospital is located in Baltimore City in the Canton area, and there are people that run and do more activity with those dogs than they do in large country areas. So I think it really depends on the breed of the personality of what you want to do, how much activity you want. It can really depend.
Yeah. Let's talk to Johnny in Montgomery County. Johnny, thanks for calling. Go ahead.
Yes, sir. Thank you for taking my call.
You bet.
I have a wolf, hybrid wolf. But she's 80% wolf, 20% Malamute. And 10 years ago, I took her to a vet, and he was concerned about the rabies shot. He had to check it first to see if it even worked on a wolf because they got a different DNA or something. Now she's got an abscess tooth, and I'm concerned about her. She's 10 years old, and she also has like a soft lump on her side, like a tumor, but I don't know if it's tumor. It doesn't smell, but it's loose. And the thing is, she's very sensitive to people. She don't like people. And can you direct me to take her somewhere to help her with the sedate her, to take the abscess out of her tooth, sir? And also to help her with, to check her the blood and all that. Could you please help?
A lot of stuff going on. Johnny, thank you for calling.
Well, it's a lot of questions, but the area is, I think the idea of the wolf hybrid being a special citizen and not being able to be vaccinated is just not true. There were some restrictions on what you can vaccinate, but you can now vaccinate safely. So I would just call up a veterinarian in your area, ask them initially to be seen, to be sensitive about her fear of other people, and try to get a good initial social exam and then move forward. I'd be more than happy to help if you want to call my place and we'll get you that information.
How often do pets need to be sedated for a routine appointment or certainly to go in and deal with an abscessed tooth?
Well, certainly for an abscessed tooth, that's a complex dental surgery, and we have gotten so sophisticated with it now with dental x-rays, all digital, and evaluation of that. So it's not a very simple process, and it requires general anesthesia. Sedation of a pet, or we fondly call it chemical restraint, is really a way that can be helpful, but it has to be safe. So we have to evaluate first. I think our staff in general and veterinarians are very sensitive to creating a calm environment to minimize the need for that at times.
Sylvia in Washington, D.C. Sylvia, thank you for calling. Go ahead.
Okay, great. I wanted to ask Dr. Kaufman. I had a 14-week-old golden retriever puppy, beautiful puppy, and she jumped out of a moving car. The end result was what Friendship said was a complete brachial plexus avulsion. Now, I don't know whether we took her then a few days later to VOSM out in
Excellent, yes.
Columbia. But is there any, and the prognosis there was very poor, but is there any possibility that she could regain? Or I know the nerves can't regenerate, Dr. Kaufman, but is there any possibility she can regain any movement at all in that leg? Because Dr. Gallagher at the VOSM he was a neurologist and did do nerve tests on him, and everything was negative.
Sylvia, thank you for the phone call. Best of luck.
Well, and my comment is, first of all, I just really applaud you in getting the excellent kind of care that you describe.
What was the injury?
It's a brachial plexus, so in the armpit there's a grouping of nerves that basically operate the remainder of the forelimb. And if they are pulled away and traumatized badly enough, you have no more nerve function to that limb. And it can be a devastating problem, and I would have to say that as a general practitioner, we respect so much people like the neurologists at VOSM, which is Veterinary Orthopedic Sports Medicine. It's a phenomenal complex of specialists, and sometimes you have to live with the decision and look at it. You can consider, I know that they have some alternative things like acupuncture that you might consider to be helpful, and then make some choices about how to move forward, but you're getting great advice.
Nina in Carroll County. Nina, thank you for calling. Go ahead.
Hi there.
Hello.
I have a question about how long a dog should go before it's allowed to go out to the bathroom. And the reason I'm asking this is that I have a neighbor, and I take care of the dogs frequently. They are asking me to constantly go over and let this dog out at 4 to 5 hours.
Is it a fully grown, a mature dog?
A 4-year-old big dog.
Yeah.
And he doesn't have any medical problems. And I keep saying to them, he can go longer. And I know this because I've let it go longer. But it's like I have to kind of wean him through this.
Yeah.
So,
Nina, if I can ask, how long do you think it should be?
Well, I'm thinking like 6, 7, 8 hours at least. The dog should go
Are they asking you to do any light vacuuming or cleaning? So, because then I'd say that they're pretty smart. I do think a mature dog, 4-year-old with no medical problems, could go at least 8 hours comfortably if it's properly house trained. And there's certainly, it's wonderful to be able to do it more frequently and let them out and play with them. But for urination, it's not going to be a problem.
Okay, because we always, whenever I feed him, I make sure I stay there for a half an hour or so afterwards, and he poops, does his business. So he's good at that point, you know?
It sounds like which dogs do a great job of training their owners, so that dog has done a wonderful job convincing the owner that it needs to do more. But I agree with you, and you just need to tell them how it would be comfortable and probably restful for the pet.
We could probably do an entire show on that topic.
Yes.
Of bodily
and like
functions.
cleaning and recycling on the proper days, and there's a lot of chores.
But so she said she stays half an hour after the dog eats. Is that a time frame when things
that's
get
great
moving?
because it does. It's once they eat, there's about between 20 and 40 minutes where it stimulates going to the bathroom. So if you would feed immediately and take them out, you probably would miss the window when they really had to go.
So that's very interesting. So you
Yeah.
put the dog back in, the dog's going to be uncomfortable until the urge passes or whatever.
Correct.
And it's not, the problem isn't on the end of the 8 hours, it was the beginning.
The beginning, yeah.
That's why family road trips, when you stop at the fast food place, are problematic and you hop back in the car and then,
Absolutely.
surprise, 20 minutes later.
Yes.
And obviously it's not a big issue for
No,
cats.
but it's, yeah, cats, I mean, they
I mean, what's the maximum? Say somebody has a dog, it's an apartment, they're at work 8 hours, plan on,
I'd
you know,
say-
it being 9, you know, they're working late and it's 10 and you're starting to really
I would
worry.
say 10 hours for a mature dog. Guilty here myself. It has gone that long with no problem. Now they are crossing their legs and anxious to get outside, but they really, a mature dog with no problem can last 8 or 10 hours. It's again a question of if they're bored at home and other reasons to interrupt and do it more often, let them out, play with them, which is great.
We're talking about dogs socializing and getting out and the idea of having one in the city. I wanted to ask about dog parks, which seem to be multiplying around here.
Yes.
We used to have parks, and you'd see some dogs in the park. Now we have specific
Dedicated
and there's
dog
one
park.
5 minutes from here. It seems like a great thing for both the people who use the other part of the park and the dogs.
Well, and I know my hospital, we sponsored Canton Dog Park years ago, and it's wonderful, and there's a small section and then a section for larger dogs. Patterson Park has a tremendous dog park, and they're really great because our pets are our family, are part of our family, and they really want to have a place where they can run and play and be well behaved.
Is there such thing as too much socializing in terms of, I don't know, kennel cough and other things that are communicable?
That's where vaccinations become very important, and in our Baltimore region, we really do have the diseases that these vaccines and preventives are designed for. It's an unfortunate scenario, but I do feel it's much like having our kids at daycare at schools. It's worth it for them to have the fun and the socialization to even get some coughs and colds and bumps and bruises.
Let's squeeze in one more phone call. This is Bevon in Washington, D.C. Thank you for calling. Go ahead.
Yes, sir. I'd like to know, I have a 5-year-old Yorkie poop, and ever since I've had him, I've had a habit of just filling his bowl up with dry food and just waiting until he finishes eating it. And someone has told me that I should portion his food, like put a little bit in the morning, am I doing, what would be the best way to feed
The ideal way is to not free feed as you're doing, but to portion out the food. And depending on your dog's weight and what product you're feeding, which, by the way, good foods, corn-free, great diets like Blue Buffalo, Wellness, Veris are really now excellent diets that are affordable. And feed the total amount, whether it's once a day or divided twice a day, is a much healthier way for your dogs than allowing free access. Cats as well.
Very good. Dr. Jonathan Kaufman of Eastern Animal Hospital. We appreciate the house
Thank
call
you.
and all your time.
Always wonderful.
Thank you, sir.
Take
Thursday at this time on Your Money and Business, why wages are going up for some while others see falling wages. We'll talk about income inequality and also see how Maryland's biggest casino plans to up the ante. That's Thursday on MPT. Thank you for watching Direct Connection and have a good night.
This program was made by MPT to serve all of our diverse communities.